in this presentation, we are going to compare the sympathetic and the parasympathetic nervous system. So what are the neurotransmitters that are being released at the ganglia of the sympathetic and the parasympathetic nervous system? So acetylcholine is considered to be the neurotransmitter released by the preganglionic neurons at all autonomic ganglia. So this means that for both the sympathetic and the parasympathetic nervous system, the preganglionic neurons release the neurotransmitter acetylcholine, or the ACH. Parasympathetic postganglionic neurons release acetylcholine as well onto their target organs. So those synapses or those nerves that release acetylcholine are known as cholinergic synapses or cholinergic nerves. For the sympathetic nervous system, so most anatomically sympathetic postganglionic neurons secrete norepinephrine onto their targets. So those norepinephrine releasing synapses or norepinephrine releasing nerves are also known as adrenergic or noradrenergic nerves or synapses. The length of the preganglionic nerve or preganglionic neuron, for the sympathetic, it is shorter, so that the ganglia, the sympathetic ganglia or the paravertebral ganglia, is near the vertebrae, or the vertebrae. For the parasympathetic nervous system, the preganglionic neuron is longer, so that it is near the ganglia, is near the effector organ. Of the length of the postganglionic neuron or postganglionic nerve for the sympathetic, it is long, so that most sympathetic ganglia are located in close proximity to the spinal cord. For the parasympathetic postganglionic neuron, it is considered to be short, so that the ganglia is localized more peripherally than the sympathetic ganglia. So they are closer to the innervated structures. Of the ganglionic synapse. For the sympathetic, it is considered to be diffuse, and for the parasympathetic, it is discrete. So when we say again ganglia, now this is the group of cell bodies, nerve cell bodies, or a group of cell bodies outside the CNS. And when we say synapse, that is the gap between our preganglionic and our postganglionic neuron. In terms of the function, the sympathetic nervous system functions to induce the massive discharge of energy, while for the parasympathetic, that is opposite because it conserves energy. The transmitter at the ganglia, so again, both the sympathetic and the parasympathetic preganglionic neuron releases the neurotransmitter acetylcholine. For the transmitter at the effector, so again, when we say effector, it refers to the innervated structures. So for example, the heart, the intestine. So for the sympathetic, mostly it is norepinephrine. So most of the postganglionic sympathetic neuron releases norepinephrine, while most of the parasympathetic postganglionic neuron releases acetylcholine. So again, when we say a nerve that releases norepinephrine, that is noradrenergic nerve, while a nerve that releases acetylcholine is known as a cholinergic nerve. So we have here a diagram now showing a comparison between the autonomic and the somatic nervous system in terms of their structure, anatomical structure, and in terms of their innervation. So starting with the somatic nervous system, so it is also a motor neuron. It utilizes a motor neuron. The only difference between the somatic and the autonomic in terms of the anatomy of its neuron is that it only utilizes one neuron that innervates the skeletal muscle exclusively. So as you can see here, the motor neuron is uninterrupted as compared to that of the sympathetic and the parasympathetic, wherein there is an interruption, there is a synapse, and there is a ganglia. For the motor neuron, since it innervates skeletal muscle, so that synapse is also known as a neuromuscular junction. Now, the junction between the neuron, the somatic neuron and the skeletal muscle. In terms of the neurotransmitter that it utilizes, so it releases acetylcholine and it utilizes the nicotinic receptor at the skeletal muscle. For the sympathetic nervous system, it is a two-neuron system. The preganglionic arises from the thoracolumbar region of the spinal cord, and it has a short preganglionic and a longer postganglionic, so that its ganglia is near the spinal cord. So the ganglia is also known as paravertebral or sympathetic ganglia. So it releases the neurotransmitter acetylcholine at the preganglionic neuron to act on the nicotinic receptor. For the postganglionic neuron, it releases the neurotransmitter norepinephrine to act on the adrenergic receptor and to act on the sympathetic effector, such as the heart. For the parasympathetic nervous system, it has a longer preganglionic neuron and a shorter postganglionic neuron. It arises from the brain and the spinal cord. And in this case, it arises in the sacral region. So its preganglionic neuron releases the neurotransmitter acetylcholine to act on the nicotinic receptor found on the dendrites of the postganglionic neuron. And we also have here at the postganglionic neuron, it releases the neurotransmitter acetylcholine to act on the muscarinic receptor. So again, the muscarinic and the nicotinic receptor are under the parasympathetic nervous system. And we also have here, the parasympathetic ganglion. The vagus nerve, or the cranial nerve number 10, is considered to be the most important parasympathetic nerve trunk. So it is considered to be the most important because it innervates the structures in the thoracic and the abdominal viscera, such as the heart, the lungs, the stomach, the intestines, and the other important organs in the viscera. This diagram shows the classification of the autonomic and the somatic motor neurons with regard to their transmitter or mediator released, their postsynaptic receptors, and their general influence on the effector organ. For the autonomic nervous system, again, we have the parasympathetic and the sympathetic nervous system. For the preganglionic, it releases the neurotransmitter acetylcholine to act on the nicotinic receptor of the postganglionic neuron. Its postganglionic neuron releases acetylcholine to act on the muscarinic receptor. So some of its important effects are increase in the secretion of the exocrine gland, such as the salivary gland and the lacrimal gland. GI smooth muscle contraction, so there is an increase in the smooth muscle contraction of the GI tract and a decrease in the heart rate. For the sympathetic nervous system, so a sympathetic nervous system releases acetylcholine on its preganglionic neuron to act on the nicotinic receptor. And most of the sympathetic postganglionic neuron releases the neurotransmitter norepinephrine to act on the alpha and the beta adrenergic receptors that are located in, for example, the spleen. So it will induce increase in the splenic contraction to, of course, supply blood in the, for example, in the skeletal muscle. Increase in the force of cardiac muscle contractions. So there is an increase in the heart contraction to, again, to increase the cardiac output to supply blood to these vital organs. Increase in the contraction, decrease in the contraction of the GI smooth muscle. So there is decrease in the peristalsis. Constriction of the peripheral blood vessels and dilation of the bronchial airways. So again, this constriction of the peripheral blood vessels is very important in order to divert the blood flow to the vital organs or more vital organs that are needed for sympathetic response or fight or flight, such as the skeletal muscle and the heart muscle. It also needs to dilate the bronchial airways in order to take in more air and more oxygen to be delivered to the bloodstream for more oxygenation of the blood. So The sympathetic and the parasympathetic are two neuron systems, but we have an exception in the case of the adrenal medulla. In the case of the adrenal medulla, we only have the preganglionic neuron that will release acetylcholine to act on the chromaffin cells of the adrenal medulla at the nicotinic receptor. So this innervation, sympathetic innervation to the adrenal medulla will release the neurotransmitter epinephrine and norepinephrine via the blood to act on the adrenergic receptors to induce the same sympathetic response. So in the case of the adrenal medulla, so there is no postganglionic neuron. In the case of the sweat glands and the skeletal muscles and some blood vessels, we also have an exception because the postganglionic neuron in these areas releases acetylcholine instead of norepinephrine. So it will the neurotransmitter ACH will bind to the muscarinic receptor, for example, in the sweat glands to increase sweating or diaphoresis, dilate the skeletal muscles, blood vessels. So this is important in order to, again, supply the skeletal muscle with the blood that is important for locomotion or sympathetic response. So again, when a nerve releases cholinergic, or rather acetylcholine, that is known as a cholinergic nerve, so for the receptors, the acetylcholine can either bind to nicotinic or the muscarinic receptor depending on the organ. For the adrenergic nerves, it releases the hormone norepinephrine or epinephrine, and it will bind to the adrenergic receptors, alpha and the beta receptors. The autonomic nervous system both innervate most organs in which they have antagonistic effects. So for example, in the heart, sympathetic innervation will increase the heart rate or tachycardia, and for the parasympathetic innervation will induce bradycardia or decrease in heart rate. For the salivary gland, sympathetic innervation will induce the secretion of scant, thick, and mucoid saliva. For the parasympathetic innervation, it will induce the secretion of profuse, thin, and enzyme-rich saliva. Of the response, sympathetic response is also known as a fight or flight, and parasympathetic response is also known as rest and digest, live and let live. So we have here an example of a fight or flight response. So what is the function of the fight or flight? So it readies the organism in response to severe rage or fear. Example, you see a raging bull charging toward your direction. The response would either be to run away and hide, so that is the flight response, or try to subdue the bull or try to face the bull, so that is known as the fight response. So whichever action you take, you need to have an increased supply of oxygen for your skeletal muscles so that there is an increase in blood flow, increase in heart rate, and increase in breathing, and the breathing becomes deeper and faster. In terms of the nutrient breakdown in metabolism is increased in order to produce the needed energy for the movement of the skeletal muscle and the pumping of the heart. Your consciousness is also heightened so that the pupils are dilated, and there is mydriasis. So one don't feel like eating or moving the bowel, so that in terms of the GIT, there is a general inhibition of the function of the GIT. The live and let live is a type of response by the parasympathetic nervous system. It reacts to generate and maintain the biologic energy. Digestive breakdown of nutrient is enhanced by increased parasympathetic activity. In terms of the myocardial oxygen consumption, so there is decrease in the contraction of the heart and decrease in the heart rate, so that the demand for myocardial oxygen is decreased. Most visceral organs have dual innervation. So when we say dual innervation in the context of the autonomic nervous system, Most visceral organs such as the stomach and the heart have dual innervation, both sympathetic and the parasympathetic innervation. This has a dynamic antagonism. So it has, again, the sympathetic and the parasympathetic has opposing actions. So this is also known as antagonism, allowing for precise control of the visceral activity. For example, the sympathetic division increases the heart rate, the parasympathetic decreases the heart rate. For the respiratory rate, it increases the heart rate, or rather increases the respiratory rate. For the parasympathetic, it decreases the respiratory rate, and so on. This table shows the effects of the parasympathetic and the sympathetic divisions on various organs. So, for example, now in the case of the sweat glands, so these are the target organ. This is the parasympathetic effect and the sympathetic effect. For the sweat glands, um, the sympathetic innervation to the sweat glands will um, will stimulate copious sweating. That is also known as diaphoresis in the cholinergic fibers. For the adrenal medulla, sympathetic innervation to the adrenal medulla will stimulate the medulla to secrete epinephrine and norepinephrine. So the cells that will secrete these catecholamines are the chromaffin cells of the adrenal medulla. For the arrector pili muscles that is attached to the hair follicle, so it will stimulate contraction. So that the hair will become erect and produce goosebumps. So that is a sympathetic innervation. For the heart muscle or the cardiac muscle, of course, parasympathetic will decrease the heart rate and increase the heart rate for the sympathetic effect. In terms of the coronary blood vessels, so coronary blood vessels, sympathetic nervous system. So there is vasodilation in order to increase the amount of blood that goes to the heart. For the urinary bladder, so parasympathetic effect will promote voiding by contracting of the smooth muscle wall of the bladder, relaxing the urethral sphincter. For the sympathetic effect, it will inhibit voiding of the urine. For the lungs, it will constrict the bronchioles, parasympathetic, and for the sympathetic, it will dilate the bronchioles in order to take in more air towards the vital organs. For the liver, sympathetic innervation will stimulate the release of glucose to the blood. And of course, this is known as glycogenolysis, or the breakdown of glucose from glycogen. The glucose is important in order to provide energy for vital organs such as the skeletal muscle. For the parasympathetic effect, it will increase the glucose uptake from the blood to, for example, the liver. For the gallbladder, the parasympathetic innervation will excite the bladder, or rather the gallbladder, and it will contract it to expel the bile. The bile is important for fat emulsification. For the kidney, the sympathetic effect or sympathetic innervation will promote the release of renin from the kidney. So again, during a sympathetic response, there is decrease in the blood flow to the kidney, and this will serve as a stimuli for the kidney, particularly the juxtaglomerular apparatus to release the hormone or the enzyme renin. The renin is important to induce the production of the protein angiotensin 2. The angiotensin 2 is important to also induce the release of aldosterone. So aldosterone in the kidney will act in the renal tubule to reabsorb sodium. So reabsorption of sodium in the blood will mean that sodium in higher amounts in the blood, since the sodium is osmotic in nature, so it will attract more water in the blood. More water in the blood would mean that the blood volume will be increased to prevent the hypovolemic shock or the decrease in the blood volume and the body fluid during a sympathetic response. Of course, in a sympathetic response, we do not want that the blood supply and the body fluid will be depleted, so that conservation of the body fluid is important during this time. There is vasoconstriction. Again, there is vasoconstriction in the kidney, so to divert the blood supply towards the vital structures such as the skeletal muscle and the heart. There is also decrease in urine output. No? So again, this is because of the production of aldosterone also, which uh, will reabsorb sodium. So reabsorption of sodium will, of course, also attract water to come with that sodium, so that there is a decrease in urine output. And this is also because of the vasoconstriction towards the kidney. So this is beneficial. The decrease in the urine output is beneficial in order to prevent the body fluids from being voided outside the body. So again, body fluid is important during a fight or flight because it will prevent the hypovolemia. So again, renin is important in the RAS system, or the renin-angiotensin-aldosterone system, and this will maintain the blood pressure to be increased. For the penis, a parasympathetic effect will induce vasodilation of the blood vessels to cause erection. And for the in terms now of the blood vessels, so there is a constriction of the most vessels and increase in blood pressure during a sympathetic response. In terms of the metabolic rate, so a sympathetic effect will increase the metabolic rate, and it will also stimulate the lipolysis or the fat breakdown. We also have the term sympathetic tone. And when we say sympathetic tone, this is a function of the sympathetic division which controls the blood pressure even at rest. So the sympathetic tone or the vasomotor tone will keep the blood vessels in a continual state of partial constriction. We also have the parasympathetic tone, and the function of this parasympathetic tone is to slow the heart. It will dictate the normal activity levels of the digestive and the urinary tract. So in terms of the times of stress, so in times of stress, the sympathetic division can override the effects of the parasympathetic nervous system. So those drugs that block the parasympathetic responses increase the heart rate and cause fecal and urinary retention. This diagram is a summary of the somatic and the autonomic nervous system. So this portion here represents the somatic nervous system. The cell bodies of the somatic nervous system neuron, or the somatic neuron, is found in the CNS or in the spinal cord. So in terms of its peripheral nervous system component, the somatic neuron or somatic nervous system utilizes a single neuron that is uninterrupted. It is the neuron is from the CNS to the effector organ. And the effector organ of the somatic nervous system is the skeletal muscle. In terms of the structure of its axons, it is considered to be heavily myelinated. And of course, the myelin sheath is important for insulation and for the quick, faster, and efficient transmission of the impulse from the nerve to the effector organ. We also have here the neurotransmitter at the effector is acetylcholine. And in terms of the effect, the somatic effect is always stimulatory, or it has a positive effect towards the organ. So it will always stimulate the organ. In terms of the autonomic nervous system, we have the sympathetic and the parasympathetic. The cell bodies of the preganglionic neuron arises from the CNS. They differ in terms of their location. For the sympathetic, it arises from the thoracolumbar. For the parasympathetic, craniosacral. In terms of the neuronal system, so it is the sympathetic has a longer, the sympathetic has a shorter preganglionic neuron that is considered to be lightly myelinated. And for the transmitter at the ganglion, we have the acetylcholine. For the adrenal medulla, it only utilizes one neuron, and that is the preganglionic neuron. For the postganglionic neuron of the sympathetic nervous system, it is non-myelinated and it releases norepinephrine at its effector organ. So for example, effector organ of this one here is, for example, we have the stomach, the intestines or the viscera, the heart, no, and the for example, no, the glands of the viscera. In terms of its effect, it has a stimulatory and inhibitory effect depending on the type of the receptors. So there are certain type of receptors of the sympathetic nervous system that is inhibitory in nature. Example is the alpha-2. And again, since most of the organs have dual innervation, so for example, sympathetic innervation, for example, to the heart will increase the heart rate, parasympathetic will decrease the heart rate. So ibig sabihin, for the autonomic nervous system, the effect would either be stimulatory or inhibitory. For the parasympathetic, again, it has a longer preganglionic that releases acetylcholine and a shorter postganglionic that is near the ganglia is near the effector. And in terms of its preganglionic neuron, it releases acetylcholine, the same with the sympathetic, and for the postganglionic, it releases acetylcholine at its effector. So these are the again, we have also have the same effector for the sympathetic and the parasympathetic. Of course, these are the organs that have a smooth muscle. For example, the gut and the blood vessels. We also have the glands and the cardiac muscle.